So we're joined by fellow class of 2000 member of Madison Central, Madison County Schools parent, nurse liaison at Methodist Rehab, Katie Rives. We thank you so much for joining us again. We got a room full here with us at Velma Jackson High School. We're recording this for all of our friends in Madison County Schools, Madison Central, Rosa Scott, Ridgeland High School, Germantown High School, the Academic Options Center, and my good friend Mary Slaughter over at MCTC, and our YouTube channel. We're in the Health Science Career Cluster, and we thank you so much for taking time for us today.
You're welcome. Thank you for having me.
Now, obviously, and I'll give him a brief history before we came on, and I'll let you tell it. You did not have the traditional path into nursing. Madison Central High School, we graduated on the same day back almost 25 years ago now. So just take us through your path into nursing because I have a lot of people that say they want to be nurses, but they just think they can walk into it. So just take us to that path because I really enjoy hearing this.
Okay. Well, I when we graduated from high school back in 2000, I had no idea that I wanted to be a nurse. That was so far off my radar. If you had told that person that I was going to be a nurse, I would have thought that was ridiculous. So for the 10 years after first 10 years after high school, I went to college. I went to Southern. I majored in art. Just doing, I thought I wanted to be an artist, which I think being an artist is amazing and that's important too. Then I got married and had some kids, so I stayed home with my kids and I was working like little odd jobs. And it wasn't until my dad had a wreck when I was 26. He had a really bad car accident and had a spinal cord injury. And that's kind of what made me become interested in nursing. He actually went to Methodist Rehab where I work now, for rehab, for spinal cord rehab. And that's where I kind of like, it's like, seems really interesting, but it wasn't until a few years later that I went back to school as a single mom with three kids, went back to school for nursing. And I graduated from nursing school when I was 32. So I've been a
Wow.
nurse in almost 11 years. Yeah.
Wow.
Yeah. So definitely, and I wasn't even one of the oldest ones in our nursing class, like there was definitely older people. Now in my nursing class, there was like, young people, and those people, I'm just so impressed by young people that know what they want to be when they're young, because I just didn't know what I wanted to be. Um, so, kudos to those students of yours that think they already know what they want to be. That's amazing.
Yeah.
But
Now,
so
I do want to talk about nursing school real quick
yeah, go ahead.
because I don't think a lot of people understand how difficult it really is because
Yeah,
it is very intense. Because obviously, one of the big pros of nursing school is it's not a 4 year commitment. They have accelerated programs you can get done in a year.
right.
However, the rigor and the difficulty and the amount of testing, the amount of papers, the amount of clinicals is absolutely incredible. So, if students are thinking about becoming a nurse, what can they expect when they start nursing school?
It it's a full-time job. I mean, I don't know how anybody could go to nursing school. Now, there are part-time programs where you can work but
Yeah.
ones that are going to take like a year or 2 years. If you're in it full time, it's a job. I mean, that is what you're doing every day between classes and clinical and then studying. The amount of studying is, I mean, it's people know the reputation for nursing school being really, really hard. It is really hard. It's a lot. It's challenging. But now I did it with kids. A lot of people in my class did it with kids. Now that's that adds a whole nother level of stress. Um, but that's what I like. I like about nursing and of course I'm a registered nurse, so that means I have, I'm an RN. But there's other levels of nursing, and that's what I really like about it. You can start out as a CNA, and work your way up. You could be a CNA and then work towards being an LPN and then work towards being an RN. And there's just so much room for advancement in the career. I love that about it. I mean, you could go on to be, I mean, there's CEOs of hospitals that are RNs, that went on to get their masters and then become
Yeah.
CEOs. So there's really, the sky's the limit, and you can, I mean, depending on how much you like school, you can just keep going to school, and then when you can work, and once you get that RN or LPN, a lot of people do the LPN and then start working and work towards their RN while they're working as an LPN. It just depends on
Yeah.
your financial.
Yeah, and I know people that became RN and became doctors. So
Oh yeah,
that's
yeah.
also a way. And med school was that much easier for them because they already had the experience working with patients. They already had all the book knowledge. It was just a matter of getting through the medical school program, and they all did very well in it.
Yeah, and I think nurses that become doctors are the best doctors personally, because there's just something about having taken care of people, really taking care of people, as a nurse, that gives you that extra compassion, that's, not all doctors have. A lot of doctors do, but not all doctors.
Yeah. Now, and something else I really want to talk about because, like I said, I have a lot of, especially young ladies, say they want to be nurses, and that's great because we need them. We
Yeah,
need good nurses. We need good people in the medical field. But I think it's very important for everybody to understand. We all see the cute photo shoots of the scrubs and the stethoscopes and everything, and all those are great because it is a great accomplishment. But I think it's important to realize if you're trying to do this just to make money, you're going to be miserable because you are having to touch body parts. You're having to touch people, pick up people. You're going to have smells. You're going to deal with bodily fluids. Unfortunately, sometimes you could see somebody pass away. You're going to see serious injuries. You're going to have to deal with vomit. You're going to have to deal with feces. You're going to have to deal with urine. You're going to have to deal with blood. And that's all a part of when people's lives and health is at stake.
right. I mean, that's the human body. The human body makes urine, feces. That's just and that is part of it. And that's kind of one of the things that was the hardest for me to get over when I was younger, before I went to nursing school, thinking about how am I going to deal with that. That part seems a little tricky. But you kind of develop a tolerance, and then after a while it's just kind of normal. I mean, and you think about yourself, we each have those bodily functions, each individual person. So you can just empathize with the other person on, how they're feeling. It makes it not so gross. People are like, oh, it's so gross. It's really not. I mean, you get used to it. But this idea of the cute nurse that, like the nursing Halloween costume that are, people say, like the attractive nurse, that's not real. It's a hard job. It's a hard job. And yeah, and if you just did it for money, you wouldn't last long.
Yeah.
There has
Now,
to have.
yeah, I agree 100%. Now, and I'm not trying to steer people away, but I think it's important to understand the reality of the field because obviously, like we've said multiple times, we need good nurses, but they just need to understand what's going to be expected.
For sure.
Now, if let's say we have somebody that says, I want to work in the medical field, but I don't want to commit to a full nursing program. I don't know if I can afford to go to nursing school. There are tons of other great needed professions in the medical field. We
Oh,
need techs. We need people to run the machines. And we mentioned CNAs. We need people to prepare the food. We need people. We need phlebotomists. So, what are some of these other jobs that are having more and more need in the medical field that you're seeing?
so all the ones that you mentioned, respiratory therapy, that's a huge one. Nurses cannot do their jobs without respiratory therapists. One thing that people don't, I didn't even think about until I became a nurse was there's biomedical technicians, which is people that work on the equipment
Yeah,
in the and there's a program at homes actually for that, and they do really well financially, and it's a good job. You're working for a hospital is always a good place to work. It's like a team environment, because we all work together. So those other jobs, dietary, you mentioned working in the lunch line. I mean, all of those jobs, we have to work together to take care of the patients. So many people that work at a hospital don't actually put their hands on the patients, but they do contribute to the patient
absolutely.
significantly every day. Even the cleaning staff, somebody has to come clean those rooms every day. Somebody has to empty the garbage. Somebody has to wash the sheets. All of those roles are important and make up the system.
Yeah, and I'd be remiss if I didn't mention the pharmacy people as
Oh,
well, because people think pharmacy is just pills. All those IVs have to be mixed correctly. All those syringes and everything have to be properly taken care of. So the pharmacy staff in a hospital just is extremely important.
yes, and that you have to be incredibly intelligent, to be able to manage all of those things, because you have to know about the human body, you have to know about medicine, you have to know about medicines, and you have to be good with math. So I think if anybody's ever really interested in math, pharmacy is a really good thing to consider. Like if you think you might want to be a CPA, you might want to be a pharmacist, because it's a lot of math and it's interesting math.
Yeah, and you mentioned about the people that fix the machines. There's never been a bigger need for technology-based jobs in the medical field, because if the server goes down at a hospital, it is just absolutely catastrophic because you have charting, you can't chart what if it's down, you can't see people's medications or special diets, you can't handle people's payments. You got personal information on there, so the amount of jobs on the IT side in a hospital has never been greater than it is now.
Absolutely, and it's only going to get bigger. There's one thing that I thought of when you were speaking. We have it's becoming more and more common for patients to not speak English. Okay. So one job that probably nobody thinks about is translating for patients. That is a huge thing that we need. We need bilingual nurses that and we need bilingual respiratory therapists. If you have any interest in learning another language and being a nurse, the opportunities there are huge.
And that guarantees a higher pay rate per hour as well.
And a higher
Um,
Right now at my hospital, we have an app where we call a translator, like on a Zoom. The patient's there, and then we call this translator. So it's not as personal as having an actual person, but it's hard to find, actual people that can come and translate in real time in person.
and that includes people that sign as well. There's never been a bigger
Right.
need for ASL translators.
That's a language. ASL is
Yeah.
a language for
Now,
sure.
one thing we talked about last time, and I mention this every time I have a medical person, is we talk about so many other fields how we need women to get into them. We need men to get into nursing. And every female nurse I talk to says if we just only had one or two more guys on the floor, they're able to reach things we can't reach. They can move people we can't move. People will talk to them when they won't talk to us. So how big of a need is it for men to consider careers in nursing?
It's huge. And some of the best nurses that I've ever worked with are male nurses. But having a male nurse on your shift, it just makes the shift so much better. Yes, because they can lift heavier things. They can reach higher places, just like you said. Also, it just brings kind of a different dynamic. Their personalities are a little bit different. And everybody, we need all kinds of personalities, to first of all, to make the job fun and tolerable. I mean, you don't want to go to work and be miserable every day. You want to have, you want to be happy at your job. And I think it takes a lot of different kinds of personalities for that to work.
Yeah, and just sometimes people are more comfortable, especially if it's a sensitive body part. A male might feel more comfortable talking to a male nurse. Same thing with females. I know a lot
Yeah.
of females, when it's a sensitive female issue, they'd rather talk to a female professional. And little things like that can make a huge difference. It's a huge difference in patient care.
Yes, absolutely. I mean, if you have a male that won't speak to I mean, yeah, sometimes you just have to find what the patient needs, what each individual patient needs. It may be that they need a male nurse to open up, or maybe they need a female nurse to open up. And that's part of, knowing your patients and taking care of them.
Yeah, and so that's why I really encourage all of our young men, if you're interested in the medical field, really consider nursing because there has never been a bigger need for men to get into this field. And I hope that some of our young men at least consider it because it really is a field that desperately needs them right now.
Me too. I have boys and I wish that they would, but so far nobody's interested, but they're still young, so we'll see.
Now, before I get to their questions, one thing I want to talk about as well is we mentioned about the technology professionals in the building, but there's never been a bigger need for medical professionals to learn these new technology programs because with the way medicine is changing, there's a lot of AI programs that are coming about, a lot of robotic programs coming about. So it is not just the old school like our grandparents did, where you're just going in there and asking a bunch of questions. There's a lot of technology that goes with diagnosing and measuring and all those type things in a medical facility. So, what are some of these technological advancements that you've seen just in the last few years?
So AI has become a huge part of life, as you know, but in the hospital, just in the last year, I've seen things change. Like, for example, when the patient is admitted, instead of an actual human nurse, me, going to the room and asking the patient the admission questions. This is at Baptist Hospital specifically that I'm talking about. They have a virtual nurse. You put an iPad in the room, the virtual nurse talks and asks them all the admission questions, like, what kind of medicine do you take at home? All of those kind of things. And that's all virtual. And it frees up the floor nurse, to be handling other things that are possibly needing to be prioritized over asking those questions. That's a huge change that I've seen recently. And it's really helpful, because as a nurse, you're always stretched thin, and you always have more really, and you have to and you decide what to do, asked and what not to do. Sometimes asking little questions like, oh, do you have steps in your home? That gets left off because it's not a priority. But if you have that admissions AI nurse, they can ask all those questions. Things won't get missed as much.
Yeah, and that's funny that you mentioned that. We were just looking at modifications that had to be made to a home of a spinal patient, and that is a very big deal. Is the post inpatient care. That is something that is another great career to get into because if you can help design homes, design chairs for things like that, you're going to be looking at making a ton of money.
Yeah, physical therapy, occupational therapy, and just people, like, for example, every time somebody has an accident, whatever, car wreck, whatever, you you need to be in a wheelchair for a certain period of time. Well, guess what? Now you need a ramp to get into your house. I mean, just having a company that built just ramps, that would be incredibly lucrative if you had those skills and you could just build a ramp, in a week for somebody, because that's a need. That's a huge need. And that's part of what we do at Methodist Rehab, is help people find resources, because most of our patients do need some kind of equipment, home modification. Yeah, that's a huge industry that, there can never be enough people.
Yeah, and just real quick, 'cause I'm glad you mentioned that. I know because you talked about when they're there at rehab, y'all do a great job of once somebody has that injury, once they have their initial treatment, y'all do a great job of working with them on techniques on how to get around. Because obviously their life is going to change. If they may have loss of use of one side of their body, they may have loss of use of their arms or their legs. So they're going to have to keep living. Y'all do a wonderful job of teaching them how to adjust to that. And we need people to get into that field. I know the OTA and PTA programs at Hines and Holmes are desperately needing people, and everybody that I know that's done those has been very happy with it. So there's never been a greater need for physical therapy assistants, occupational therapy assistants, uh, physical therapists, occupational therapists to deal with that post inpatient adjustment once somebody has had that life changing injury.
Yeah, I agree. It's something that you don't really think about unless it happens to you or one of your family members, but you do. After you have a catastrophic accident, stroke, you still have a life to live after that. And you have to adapt, to your new, whether it be, your left arm doesn't work anymore or your legs don't work anymore. You still want to live your life to the fullest. And that's where PTOT comes in. And those people are amazing and they're so smart. And they're at Methodist Rehab are just top notch. I mean, they're just the best and the absolute best in the field. It's an amazing.
I agree. Y'all do a great job over there. Well, I do have some questions from the students. I'll get to as many of these as I can. These are really good. This first one is Shania Smith. She's in 10th grade, one of our volleyball players here. And she asked, besides all the studying and all the tests, what is the hardest thing you've had to learn once you became a nurse?
Okay, that's a good question. And the hardest thing I think to manage as a nurse is the expectations of people, the expectations of patients. There's this idea that, something's wrong with you, you come to the hospital and we'll fix you right up. That's not always the case. And managing those expectations in people is sometimes very difficult. Sometimes it's the family even more than the patient themselves, that and part that is where education comes in. You educate the patient, and the family on what's wrong with the patient, what they can what kind of recovery they can expect, because knowledge is power and people feel more in control of their situation when they know what to expect. So good question.
Big time. I like this one. This is Sanaya Norman. She's a sophomore, one of our cheerleaders. And she asked, how do you handle workplace stress?
Well, I like to do online shop for stress relief and talk to my friend, talk to friends, just the way that anybody deals with stress. You find little things that help you cope on a daily basis, and you do those things, whether it's exercise, which is super important, or going to a therapist, or having hobbies. All of that stuff is really important to have a well-rounded, to stay happy in your career.
Yeah, and that would be for any career, but especially nursing. I like this one. This is Isaiah Ray. She's in 10th grade. Her list of things she's in is too long to name because she's in a lot of stuff. But she asked, what are some things that you've learned from some new things you've learned from your experience as an RN?
Oh gosh, every day is a new learning experience. And I think that's what I like the most is I've never been bored in this job, not one day. Every day I learn about a new disease process or a new way to hurt yourself, or a new, just something new comes up literally every single day. And to me, exciting because for one thing, medicine's always changing. So what you learned last year, may be different this year. So you're constantly having to update yourself to get new information. So there's no room for boredom there.
Big time. Well, I got time for two more. This is Demontre Strange. He's in Tinker. Plays football, basketball, and baseball, so he's playing everything. And I like this question. He goes, "You're a nurse liaison, so you supervise people. So how do you provide feedback to your nurses when they've made a mistake?"
So when staff members make a mistake, everything is a learning experience, and unfortunately, the best way to learn is through the hard way, which is to mess up. So there's opportunities for that every single day. If we make a mistake, let's think about what we could do differently next time. And specifically what you individually can do different because I can't control Greg. Greg can't control Katie. Will you individually be able to control and do differently next time? And then you just have to go forward. I mean, mistakes are part of it. You just have to go forward and try to do better every time. Now, of course, there's some mistakes in nursing that are catastrophic, and we're not talking about that. I'm talking about, small things. But yeah, it's just a learning experience.
Big time. All right, I got one more. This is Bryson Stevens. He's in ninth grade, and he asked, "What's the hardest part about being a nurse that people may not know about?"
The hardest part, well, I mean, people know about it, but anytime you lose a patient, that's extremely hard. Um, and it sticks with you, and it's not something that you forget. I don't think no matter how many times it happens, just hard. So, but then on the flip side, you're helping so many other people. The percentage of people that you're helping, it's just you can't even compare. But there's a lot of really, really high highs, and there's a lot of really, really low lows, and you kind of have to be ready for both of those things as a nurse.
Absolutely. Well, we're almost out of time, and we thank you so much for taking some time for us. But a couple things before we go. Um, First of all, like we mentioned, we graduated high school together, Madison Central. We're both proud Jaguar alums.
Yes,
But did anybody ever take the time to explain to us all these different career paths when we were in high school?
absolutely no, no, absolutely not.
Yeah.
The
Yeah,
close,
and that's not a knock. Yeah, and that's not a knock on our school,
no,
but
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 great,
the
great school.
yeah, but
No,
the way the options that are given to these kids now, I think they need to realize how blessed they are to know that there's so many options they have after high school, and it's not just you're either going to college or you're not.
right,
So I just think it's important that they understand that all these kids in Madison County schools are so blessed to have people like you that'll take the time to talk to them. Because even though we had some incredible teachers, incredible administrators, and a great community, that was not the aim of the schools at the time. And
right.
I think they're so blessed to have people like yourself that have done that, and I think they need to realize that. Um, so I'm glad you agree. And it's funny, all of our
They're lucky,
classmates said,
Greg. They're lucky to have you because you facilitate all this. So
"Well, it's not about me, and I appreciate that, but it's just a matter of the district of our district kids knowing how lucky they are to have this information." Now the last thing, and we talked about all the pros and cons of the medical field, but like we said, we need good people in this field because lives are at stake, health is at stake, families are at stake. So why should these kids really consider joining the medical field at any point of entry once they leave high school?
if you want to make a difference, I can't imagine anybody that would say, I don't want, that's not something I want to do. I don't want to make a difference in people's lives. Of course you do. Everybody does. If you want to make a difference in people's lives, then, healthcare is the way to go. I mean, I'm not knocking being a lawyer or being a CPA. Those things are all needed too, but healthcare is just you get to know people on a different level. I think it's really
Absolutely. Absolutely. And you do, and y'all, again, y'all do such a great job over there at Methodist Rehab. And go to the Methodist Rehab website for all the great things y'all are doing. And please give Ryan my best. Such a great guy, our other classmate. So
cool.
please give him my best at some point today. So again, Katie Reeves, we thank you so much for joining us, nurse liaison at Methodist Rehab, Madison County Schools alum, Madison County Schools parent. So thank you so much again.
Okay, y'all have a great day.
I talk to you soon, buddy.